Next presentation is by Professor Lotan from Jerusalem, Israel. He is also the immediate past president of the Israel Society of Cardiology, and I think that starting from tomorrow you are going to be, Chaim, the immediate past president. Professor Lotan is involved very much in innovations, and I think that there is no one better than him to provide the next talk, which is the impact of digital revolution on cardiovascular medicine. Please, Chaim.
Thank you very much, Yossi. Professor Pinto, it's a real pleasure to be here as the past immediate president. You can have president-elect, president-eject, and president-reject. So, either one of them. My role is to talk about the impact of digital revolution on cardiovascular system, and we'll see that the digital revolution is really going to take a very important path in our life, combining connected health. I'd like to talk about several issues: the changing ecosystem today, the three important Ps, patient, physician, and the payers, remote monitoring with application, wearables, implanted sensors, the needs in the cardiovascular system, and where are we going from here. So let's talk a little bit about the rise of mobile. And as you can see, in the year 2012, the number of iPhone and smartphone were more than actually total PCs. And as we can see, mobile services are becoming the center of our life, and the connected consumer is connected everywhere and anywhere. You have more than 6 billion mobile connections worldwide, of about 83% of the population. Actually, there is a slide by Peter Fitzgerald showing that you have today more mobile phones than toothbrush in the whole world. And if you look at it, you have the combination of everything, all the talents. You have the drug companies, Novartis joining Google, joining the IT and the MT. So everyone is joining towards the digital health. And this is really bringing into a change in the ecosystem, where you can see the smartphone, the application, the Google glasses, all of them coming together. And the VC community actually is responding, and as you can see, there is a big rise in digital health money and funding coming. That this is the year 2011 and 12, and as we can see, even in the last 2 years, 2012, 13, and the beginning of 2014, and the VC community is showing that it's really becoming a very important market. Now, what do we gain as physicians and patients from the digital revolution? And we can see a host of things that can be done. First of all the way from lifestyle monitoring and modification, the issue of drug compliance, which is a very important issue, all the issue of clinical trial monitoring, pre- and post-procedural patient monitoring, predictive monitoring, which is becoming very important to monitor high-risk patients. How do you evaluate which patient is going to fall, to bleed, to have complication, and all the therapeutic variables. When physicians are asked what do they want from the digital health, 88% of them want the patient to monitor their health, and 74% would like to share the patient's information electronically. So there is a big need from the physician to use those, but also the patients. And half the patients or the consumers say that they would buy mobile health technology to monitor fitness, well-being, allow the physician to remotely monitor them, and continue monitoring a previous condition. So actually you have a mutual benefit, both for the patient and for the doctors, both partnering for their own care. But even the third party, the payers, are very interested, because you need to provide the benefit throughout the entire chain, and today you can show that you have cost saving, and you can have very nice delivery model to improve the health. So it's all the way from the patient to the professional to the payers. This is bringing the entire issue of remote monitoring. both by application, wearables, and the implantable sensors. It started with the age of application, and if you look today at the Androids or the iPhones, you can have hundreds of thousands of applications, all the way from tracking your well-being, training, nutrition, and you can monitor today very cheaply, very easily, everything. You can have a disease management with your doctor. You can monitor your blood pressure. You can put it in. You can talk to your doctor, see what was yesterday, today, and actually have a continuous discussion with your physician, which has brought to the emerging set of all the wearable, and we'll discuss it a little bit, from all the smart watches that you have, Apple watches, Samsung watches, Google watches, Google glasses, etc. And just in the last few days, we heard about the new Apple Health Kit, and Samsung is coming up with what they call a SIM band, where you will have on the wrist about several hundred sensors, which you can actually hire and will give you ability to sense everything. This is bringing the ability to have telemonitoring, and you can have them through wearable, ingestibles, implantable, and even tattooable. So you can have today monitoring any way you want it to be. This is the first smart shirt that is in the Smithsonian, and actually we are proud to have an Israeli company which is called HealthWatch, which just received FDA approval. You have the sensing elements in the shirt, and you wear it 24 hours a day, so you don't have to at all to be bothered. And you have a wearable device in which you have sensing all your vital signs, immediately controlling, analyzing, have a personal advisor, sending it to a center, so you're 24 hours monitored. You can have a mobile personal layer, and this is another startup from an Israeli company. You can sense and monitor the way you're taking your medication, your drugs. You know, if something happened and you missed a vitamin, it alerts you and it tells Daddy, and it sends automatic SMS that you forgot, and you can even tell your Dad, you forgot to take your medication today. What's going on? We do know that non-adherence is one of the biggest problems of medication, and it's both a problem to the patients and the health system. You know, you can prescribe the medication, but if the patient doesn't take it, you don't have adherence. And here you have the ability to have smart pills, smart pill boxes, and activity alerts for compliance, and this is really going to change the way we practice, especially with all the drugs that needs to be monitored carefully, antithrombotics, antidiabetics, etc. You have today biosensors, which can be big biosensor and can be very small biosensor that are tattooed in your hand. You can look at this little tattoo. It has hundreds and thousands of monitors, and you can see that actually in the future you'll be able to have 1 trillion sensor which is tattooed on your skin and will be able to monitor everything immediately. This is also the era of implantable hemodynamic monitors, all the way from monitoring PA pressure. Oh, what's going on? Back, forth. Monitoring PA pressure, RV pressure, LV sensors, and through pacemaker, we can monitor everything which is going on. I'm sorry. What are the needs in the cardiovascular medicine? We thought that actually we finished all the diseases and mortality is going down, But as we can see, and this is part of the talk that I gave in China recently, globally, it's still a very big problem. 1 in 3 deaths in the world are due to heart disease or stroke. 17 million heart disease deaths per year. 2.6 million heart disease deaths per year in China, which is calculated to be 7,000 per day in China. I gave there a talk of 20 minutes, 70 deaths. Heart disease is also #1 killer in China. And when I had a discussion with a colleague in China, in Beijing, a very small hospital, only 6,000 beds, he told me that they have about 11 minutes to see a patient today, but in 2-3 years, it's expected that they'll have 8 minutes per patient, per clinic visit. And what can you do in 8 minutes unless you get all the data, analyze them, and have it ready before the patient comes? Which means that you have to have some kind of remote monitoring that monitors all the disease and the problems before you come. And monitors today take into consideration most of the problems that we have in the cardiovascular disease. Heart failure, post-MI, arrhythmias, diabetes, hypertension, coronary COPD. And you can see that this is a penny, and you can see that you can have sensors today that are almost close to nothing and can give you everything. And you can have access today to almost everything that you want to monitor. ECG, arrhythmia, heart rate variability, saturation, respiratory rate, relative exertion, temperature. So you can have actually a very small sensor that will sense everything, for example, post-procedure, or will monitor the patient for side effects or drug control trial or anything that you want, and will build you predictive algorithm for the patient. One of the most important fields that we want to monitor the patients is, of course, heart failure. We know that we have recurrent bouts of episode of heart failure. Each event, the myocardial injury, contributes to progressive heart failure, and the patient actually is dying in the bed swelling. We can see that coronary death indeed are going down, but heart failure almost tripled, and we have 1 million hospitalization, that's United States number, per year, with only for heart failure $20 billion expenditure on a yearly budget. So monitoring heart failure is a major issue, and you would like to do it in a non-invasive. You can monitor a host of biological parameters and use to relative to the same measurements that the patient has before, so the patient actually is his own control, and you can monitor, send all the data that you would like to monitor, fluids, bioimpedance, temperature, whatever you want, and it's monitored centrally. This is slides by CardioMEMS, company that started by Jay Yadav, who wanted to develop a sensor that is implanted in the pulmonary artery. You can see that you implant it. The best way maybe to analyze the pressures in the right side is due right heart catheterization, but it's invasive, risky, costly. So how do we measure it? We can measure it through implanting a very, very small sensor that is implanted in the distal PA. You can have a complete database of the patient PA sensoring. This is the device. The patient is sitting at his home. And through radio frequency, you can get all continuous PA measurement. And they just finished a very nice study showing that you have a significant reduction in cumulative hospitalization, both at 6 months and after 6 months, with a relatively significant, between 30 and 40% relative risk reduction. And you see that the number you needed to treat in their calculation is relatively low. 8 patients in the first 6 months, 4 patients later on. So it's really becoming a cost-effective, and despite the fact that it's about $20,000 implantation of such a device, is very important. Kima Medical, an Israeli company, which is using technology which comes out of the army. It's a radar that can detect the amount of fluid that you have in the chest, and again, a very small remote miniature sensor detected by the radar, and you can calculate, as you can see, the amount of fluid, and it provides you early warning of pulmonary edema. Another way of monitoring which is developing is the CareLink by Medtronic. It's a very, very small device that, as you can see, you can implant it through an injection bedside in the office, and it gives you continuous data that is sent to a central station, and you can have continuous measurements and combine actually physiological data with anatomical data, with home monitoring, and you can adjust parameters from home even without the patient knowing that he has a problem. So the question is, where are we going, and what's going to be the future of connected health? And it seems that we are somewhere in the middle. We started, there is something, but there is a long way to go, a lot of problems that I don't want to go into all of them. But if you just look at the market of application, about 20% of the application worldwide are either lifestyle or health. So health is becoming a major part of the application. And if you look at health, cardiology is about 17%. So definitely cardiology is a major part of the health application. And as you can see today, you can have the patient in one side of the world, his physician in the other side, the sister in the third place, and you can have everything all together, and today you have available on the net a way to connect everything together. You can have integrated digital technology to improve, for example, interventional procedure. You can have pre-procedural assessment, planning, post-procedural support, and what's more important is monitoring. We know that about 10% of patients after interventions are readmitted, which is a very high price. And today, they're using what they call predictive analytics, taking a very big database to analyze and predict which are the patients that will be admitted, what are the problems, and then determine the readmission risk for a specific patient. You can use big data for healthcare analytic, and you take everything together, and then you can use them for epidemiology, you can use them in the future for drug trial, and of course for personalized care. There is a host of problems to be solved because you have to build new business model, and they will emerge. Who is going to pay for all those home monitoring? HMOs, the patient, the provider, the payers, the hospital system. There is a very interesting system in the United States where the hospital today is being punished if the patient is readmitted within 6 months because they have to pay for the readmission. So actually hospitals in the United States are today more interested to find tools to prevent readmission than the HMO themselves. So it brings upon a lot of interesting things. And also the revenues are becoming higher. You can see that this is the outpatient revenues until now. But if we look at the future, the worldwide mHealth revenues, they'll be much higher, and this is why the interest of the VCs is so high. Amir Lerman sent me just last week a very interesting meta-analysis that they did in the Mayo Clinic looking at digital health intervention for the prevention of cardiovascular disease. They did systematic review of all the literature, and there is not much. But even now, we can see that for especially secondary prevention and heart failure, using digital technology, we have a significant reduction in events using only digital technology compared to regular technologies. and the same is on interventional on weight. So the whole world, really, our world of looking at patient, watching patient, is really going to change. I believe that mobile health tools will change the way we monitor the patient. The patient will be self-monitored by a lot of sensors, as you can see. Care links, automats will be sent to the iPhone, will be sent to the physician. You'll have drug automate that will help the patient to control the drug. The data will be on the cloud. You'll have a server, and this will send to the health provider. So the whole system will change, as you can see now. So thank you very much, and it seems that we'll have to replace our stethoscope by a stetophone. Thank you very much.